Hello, my name is Kylie Jordan and I'm presenting Assignment 1, Professional Capacity Building, Student 103-56497. Introduction. This presentation will focus on my dream nursing job and the rationale as to why I feel it's my dream job. We will look at a SWOT analysis, strengths, weaknesses, opportunities and threats. And the following slide will then look at 5 goals to achieve my dream job and 5 pieces of literature relevant to my chosen career. My dream job. It's as a registered nurse with the Royal Flying Doctor Service, Australia. The reason why it would be my dream job is that it incorporates nursing, travel and aviation all into one. I'd be required to nurse each patient on a day-by-day basis, not knowing what the next day would bring. I would be out in the hospital setting and into an aviation Australian outback setting with those in isolated, not so isolated areas requiring nursing assistance. The diversity, travel and small work environment is what makes a job with the Royal Flying Doctor Service my dream job. SWOT analysis. So strengths. My strengths is probably customer service in my current employment, communication, initiative, conflict resolution, integrity, confidentiality. I feel I'm mature and self-motivated, completed a diploma in enrolled nursing and completing a degree as a registered nurse. My greatest achievement is becoming a mother. My weakness is a lack of self-belief, lack of high school qualification. I have not completed years 11 or 12. Lack of confidence, quiet in new surroundings so that can be mistaken for a lack of knowledge. Poor memory, which hinders my learning. Family commitments, which hinder any relocation for certain positions. Juggling financial commitments, so work, study and family commitments. So that could be a weakness. Opportunities, obtain a degree in registered nursing, seek higher education. So greater learning, maybe one day becoming a midwife. Change my current place of employment to a nursing environment. I enjoy both the public and private sector. So either position or area of care is fine. Apply for a scholarship to achieve my dream job. Look for temp work to gain experience. And have the support of my husband, education and current employer support. Threats. Potentially a requirement to gain steady employment due to financial responsibilities, preference for a certain amount of experience, lack of skills, childcare concerns, so who's going to look after my baby if I have to travel, so that also could hinder my travel for my dream job. Someone with relevant skills and suitable lifestyle may take the position over myself. They don't have the family commitments or the baby, so they can travel without having to worry about that. Personal development plan, registered nurse. So my 5 goals is to complete a Bachelor of Science degree by 2016, complete a 1-year registered nurse postgraduate program, complete a position in emergency department or intensive care unit, complete 5 years in a registered nurse position, and apply for a registered nurse position with the Royal Flying Doctor Service. So professional practice, critical thinking, analysis, provision and coordination, collaborative and therapeutic practice. So goal 1, complete Bachelor of Science degree, comes under domain 2.2, domain 3.1, domain 7.5 and domain 10.1. So the first domain, 2.2, integrates organisational policies and guidelines with professional standards. So maintain current knowledge, and that's what I'm doing as a student completing a Bachelor of Science degree. There's domain 3.1. So it relates to self-appraisal, professional development and value of evidence and research for practice, reflecting on practice, feelings and beliefs, and the consequences of these for individuals, groups. Identifies the relevance of research to improving individual group health outcomes. So make sure that my research as a student completing a Bachelor of Science degree is up to date and relevant. Domain 7.5. Delegates aspects of care to others according to their competence and scope of practice. So delegates aspects of care. So understand I'm still a student and I have only a certain amount of scope of practice, and that is domain 7.5. Domain 10.1 recognises that the membership and roles of healthcare teams and service providers will vary depending on an individual's group's needs and healthcare setting. So recognises the impact and role of population, negotiate, refer to healthcare providers. So understand I'm still a student. If something comes up while I'm completing my Bachelor of Science degree, who I can refer it to as part of domain 10.1. Goal 2, completed a 1-year registered nurse postgraduate program. They are domain 1.2, domain 3.2, domain 5.1 and domain 9.1. So domain 1.2 fulfills the duty of care. So as a postgraduate student, understand that postgraduate 1-year registered nurse, recognise the responsibility to prevent harm, reform nursing interventions following comprehensive and accurate assessment. So just to fulfil my duty of care. Domain 3.2 uses best available evidence, nursing expertise and respect for the values and beliefs of individuals, groups in the provision of nursing care. So use relevant literature. I'm a postgraduate 1 year, make sure I'm up to date with policies and procedures of the hospital environment that I'm currently employed in, and expertise and education so that I continue to improve my scope. Domain 5.1 uses a relevant evidence-based assessment framework to collect data about the physical, socio-cultural and mental health of the individual group, and approaches and organises assessments in a structured way, collects data. So as a 1-year registered nurse postgraduate, make sure I collect data, ask questions, use relevant evidence-based assessment framework. Domain 9.1. That's for my goal number 2, 9.1. 9.1. It is establishes therapeutic relationships that are goal-directed and recognises professional boundaries. So make sure that I remain professional in my nursing care, a patient as a patient, and we need to maintain that professional balance, and also with other healthcare providers, keep our work environment professional. Complete a position in ED and ICU, domain 2.3. So that is for my goal number 3. And so domain 2.3 is undertakes assessments, practices in a way that acknowledges the dignity, culture, values, beliefs and rights of individuals and groups. So in a position in ED or ICU, make sure that the person may not be able to speak, or they may be unable to communicate at a certain time because of the high care that they may be receiving. So make sure that we acknowledge dignity, culture and their personal spiritual beliefs, or even those of the family. So make sure that we're sensitive towards that. Domain 3.3 is my next domain for goal 3, and that demonstrates analytical skills in assessing and evaluating health information and research evidence. So demonstrates understanding of the registered nurse role, make sure I do my research and really make sure it's evidence-based practice that I continue to do. 5.3, it is analyses and interprets assessment data. So in the ED ICU setting, make sure that I continue to recognise clinical judgments, identify types and sources of supplementary information, and demonstrate knowledge of quantitative and qualitative data. So really do my study and analyse and interpret data, which you get a lot of in that setting. Domain 9.5 is the final one for goal 3, and that is facilitates a physical, psychosocial, cultural and spiritual environment, and that really builds on the other domains. So making sure that we demonstrate sensitivity, maintain infection control, especially in the ICU section, prioritise safety problems. It's a high care and a fast environment, so make sure that we are still safe and that the patient is safe at all times. Complete 5 years in an RN position, that is domain 2.4. That's for my fourth goal. It advocates for individuals, groups and their rights of nursing and healthcare within organisational and management structures. So as a fifth year, I should be really building on this and increasing my nursing knowledge. Domain 3.5 is for critical thinking. Participates in quality improvement activities. So by 5 years, I should be participating in case review activities, participating in clinical audits and really showing my experience and knowledge as a fifth year nurse. Domain 6.1 is the next one. Goal 4, 6.1, determines agreed priorities for resolving health needs of individuals and groups. So determining the care by fifth year, I should be able to do this. Consider individual group preferences when determining priorities of care and performance review processes. So that's domain 6.1. And then domain 10.2 is the last domain for goal 4. 10.2 communicates nursing assessments and decisions to the interdisciplinary healthcare team and other relevant service providers. So explain the nursing role, be able by the 5 years to really teach other student nurses, document, discuss individuals and be able to collaborate quite confidently with other team members and service providers. Then my fifth year is my dream job, which is RN position with the Royal Flying Doctor Service Australia, and that is domain 2.5 for the first one. So domain 2.5 is understands and practices within your own scope of practice. So as a nurse with the Royal Flying Doctor Service, I would be requested to be nursing quite individually, make sure that I practice within my scope of practice and know my limitations when caring for anybody while we're out in remote communities or out on a care flight to pick up a patient. Domain 4.1 is for critical thinking and analysis. So 4.1, for my fifth goal, it is uses best available evidence, standards and guidelines to evaluate nursing performance. So if I am in outback situations, make sure I have the best available evidence, best standards and the best care of nursing practice for this fifth goal. Then it's domain 6.2. 6.2 identifies expected and agreed individual group health outcomes, including a time frame for achievement. So make sure I have my goals and I use my resources to support the achievement of outcomes of both myself and the healthcare team and the patients that I may come across. Then it's domain 10.4 for my final goal and final domain, so 10.4. By then I should be able to collaborate with the healthcare team to inform policy and guideline development. So consult policies and guidelines, demonstrate awareness of changes to policies and guidelines, attend meetings and participate in practice review and audits. So by this time I should be able to confidently collaborate with the healthcare team and look at any changes to policies and procedures. Build on each domain as experience is gained, attend in-service education and greater education, and this is my 5 to 10 year goal. Literature relevant to my dream job. So the first one is titled, What Does Nursing Teamwork Look Like? A Qualitative Study. And this is the Journal of Nursing Care Quality, and it focuses on nursing teams, how teamwork constitutes a more productive work environment, patient safety and staff that are willing to stay in a position for a longer period of time. So that's relevant to my dream job. It's made up of a team environment with a doctor, a nurse, a pilot or captain, psychologist and dentist. And it's a really small team, so that literature is really relevant to my job. Then it's the next piece of literature I found relevant is The Sky's the Limit for a WA Nursing Student. And that is another journal article on a young nursing student who had the same dream of the Royal Flying Doctor and who managed to go on a practical placement with them and her experience with that. The third one is Royal Flying Doctor Service Roaring New Jet to improve patient care. The Royal Flying Doctor Service will have a new aeromedical jet expected to halve the flying time for the long-haul patient evacuations. So as you're flying to collect patients, there's a new jet that the government have provided, or the Royal Flying Doctor Service have managed to purchase, and this journal article refers to the jet mentioned. It can reach patients in less than 90 minutes from Alice Springs to anywhere in the Northern Territory, and that's a 90-minute return flight and over 100 flights in a day for these jets. Then the fourth one is managing motion sickness clinical review. Obviously my hindrance is motion sickness for aeroplanes, and that could affect my dream job. So this literature is interesting in that what it shows is relevant to motion sickness, what works, what medication does work and doesn't work, what traditional remedies don't work, such as ginger. And then the fifth one is effective communication, principle of nursing practice. And that article is important for me because as a nurse, and especially in a small team environment, I need to be able to communicate, and this also relates to documentation, so make sure I can communicate on documentation as well. Conclusion. My dream job is with the Royal Flying Doctor Service Australia. I have addressed my strengths, weaknesses, opportunities and threats for this dream job and in my current situation. The next slide has then addressed my 5 goals in connection with the National Nursing Competency Domains, as well as in relation to my dream job. Literature relevant to my dream job have then been listed. In conclusion, I'll continue to study, learn and develop my skills to achieve my dream job. References attached. Thank you.